In this video, I'm going to show you movement exercises that can create a nice pop in your back and give you pain relief. Hi, Dr. Malka here, practicing in Los Angeles, California. And these movements are not a replacement for a chiropractic adjustment, but they can give you pain relief and improve movement quickly. So we're going to start with 2 tennis balls in a sock with a knot at the end. And what this does is it creates an area right here, a dip, for your spine to go through. You're going to put this on the ground, preferably a hard surface, and lay back, putting your spine right in between the 2 balls. And you're going to lift your pelvis up and just sink your back into the balls. If you want to increase intensity, create a stretch in the back, bring the elbows up in the air, and then come back with your head, lifting up your pelvis. And then come up with your head and your pelvis, roll about an inch up, and do the same action, lifting the pelvis, dropping the head back. And I felt a little pop there. That was nice. And once again, lift the head up, roll up. And if this right here is to your comfort zone, then just stay there. But if you feel you can create a little more intensity, drop the head back, lift the pelvis. And this should create movement in your spinal segments. Sometimes you won't hear an audible pop, and that's okay. Lift the head up, come up another inch, and again drop the head back. And you can continue this all the way down the spine. So to create movement in the sacrum area, that's that triangle bone just below your low back, you'll put your feet up on a chair like so, and get the 2 tennis balls and drop them right there where that sacrum is. And if you want more intensity, again, you can lift up and then rest down on the balls. And even lift the legs up a little bit and create pressure in that area. And then at this point, you can start rocking your hips back and forth. And you should feel the balls dropping off either side of that triangle bone. Lift the pelvis up, roll down, and then create pressure, rocking back and forth. If this is enough pressure, just stay here like this. If you'd like a little more pressure, lift the legs up and rock back and forth with the pelvis. And then I'm going to come down right where that tip of the tailbone is, otherwise called the coccyx, and just rest there and then rock back and forth. And if you feel like you could handle a little more pressure, lift the legs up. You can even cross the legs, one on top of the other, the ankles, and rock back and forth. This area you probably won't hear an audible pop like you would along the spine with the tennis balls, but it will loosen up that joint and allow it just to fall back into place. Another way to adjust primarily the mid-back is with a towel against a chair, just to create a little softness. And you want to sit nice and straight on the chair, hands behind the head, and just come back and drop yourself down. And come back and drop down. And then you want to slide down on the chair to get the upper segments, arms behind the head, and come back. And then you can drop down a little bit more, hands behind the head, and drop down. Now to adjust the neck area and create movement in there, you'll want a strap or a dog leash, and then bring the strap behind the head, just dropping right to the base of the skull. Pull out with the strap while you drop your head back. And then come down a 1/2 inch, traction with the strap and drop your head back. And then come down a little more, create a little traction and drop your head back. Now there's two ways to self-adjust the low back. The first one is to bring the leg across the body, foot flat, and give yourself a big hug with this knee. You want your spine perfectly straight and just turn and feel a pop. And then you can relax forward. Try it again. Bring the knee right up to the chest and then turn. And if you're on the ground, this foot's going to be straight out, but I'm doing it on the table. And then cross the other leg over, spine perfectly straight, knee into the chest, twist, bring the arm behind the back, and adjust. Oh, and I felt a little one there. Again, spine straight. Maybe you can go a little further this time and twist, and at the end, just do a little movement. Now lying down, and this one can be very effective. You're going to lie down with your cactus arms. Shoulders are going to be flat. Knee up at a 90-degree angle and drop the leg over. Make sure that this shoulder is flat on the table. And if you're very flexible, you'll probably want to do this on a bed so your knee can drop down, or you can do it on the floor. Rotate your pelvis as much as possible. Again, making sure the shoulder's flat, because if you do this, you're going to lose that tension. And bring this other hand here, right here on the top of the buttocks, and just help to drop that pelvis down. Bring the leg up. I felt that pop on the way out. And bring this leg up as so. Again, now this shoulder you're going to want to keep down. You don't want to roll that shoulder up or you're going to lose that tension. Drop the leg over. Bring the hand here on the top of the buttocks and just rotate and rotate and rotate. Another way you can do this is what we call in chiropractic a long lever, where you actually put the hand right on the leg and drop it down. I'll show that on the other side for you. Leg up in the air. This is the long lever. Bring the hand here and drop it down. And just pull and drop. All right, so now I hope you got your whole spine adjusted. And if you benefited from this, please subscribe and like. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. And I'll be available for any questions you have or suggestions for future videos.